let's bring you this now. Some are saying that the vaccine rollout program in the country is moving at a snail's pace, but on Monday, Aspen released a statement, and they were saying the 300,000 doses are currently being released, for South African teachers. But on the other hand, Johnson & Johnson has also promised, to deliver substantial quantities of that compliant finished jabs, which are meant to replace the 2 million vaccine doses that we can't use at this stage, unfortunately. But you know what? Let's get that update now with, the Bhekisisa Centre for Health Journalist Director. That is Malan, who joins us now for more clarity on this. Mai, good to have you. And good morning to you. Let's start here. The 300,000 vaccines, which we're expecting, of course, for teachers. What is that deal all about, and when can we expect them, of course, to be, administered?
So according to Aspen, they can be expected within the next 2 days. And those 300,000 doses have been made with one of the cleared batches at the US company where the contamination was an issue. So this batch is not contaminated, but it comes with a special condition that our regulators should have access to confidential data to see how that was made. And our regulator, SAPRA, did see that data over the weekend and evaluated it and then cleared it for use. So that's the first consignment that we will receive. But we also know that the CEO of Aspen, Stephen Saad, said on your station last night that we will also receive an additional 1 million doses from Aspen as early as next week, most likely already on Monday. And those 1 million doses had been packaged by Aspen with ingredients that came from a different factory, so not the one where the contamination occurred, but one in the Netherlands, in Leiden, that J&J also uses to make ingredients for vaccines. And Aspen started to package those vaccines, in other words, to fill and finish them in South Africa about a month ago already, which is why they will have them ready for release early next week.
All right, so for clarity's sake, I mean, the 300,000 vaccines from Aspen here are strictly for teachers, even though we're in a second phase now where the elderly are getting their jab, or at least registering to do so. This is not for them, it's just for teachers?
Yes, it's not just for teachers, it's for everyone working at schools.
Right.
So it doesn't really help to just, vaccinate one part of a school, because the virus can still spread. So the health department has announced about 2 weeks ago that it will be specifically for school staff, these vaccinations. We know that there were more initially. It was originally going to be 480,000, but it was then reduced to 300,000. But with the new doses of Aspen, that's also going to be released next week. If the health department, I'm not sure that if they're planning to use some of that for the teachers as well, but in total, there is likely to be enough now.
All right, that clarifies that. Let's move on then to Johnson & Johnson at the stage, Maya. I mean, we know that the 2 million vaccines that can't be used because they were found to be contaminated, from a factory in the US in Baltimore, obviously has set back the country at this stage. But I understand that they actually have committed to compliant finished jabs at this point. What do we know about this?
Yes, so part of what the Aspen statement yesterday announced, and also Stephen Saad said, was that J&J has committed to bringing in substantial amount of jabs that are already finished to South Africa, and that was made with ingredients of the Leiden, the Netherlands factory. So there's no contamination. It comes from a completely different factory. So according to Stephen's staff, we are likely to have replaced all our 2 million jabs that we can't use now within the next 2 weeks, and that there could likely even be more jabs than that for South Africa that could be coming. So within the next 2 weeks, according to Stephen's staff, Saad, we will have all our jabs replaced. That, of course, doesn't mean that we can immediately use them. The jabs that come in will first have to go for quality testing, and then they can be used.
And with that being said, because we understand South Africans are a bit frustrated right now with the process and, the delay and the slow movement, if I should say, of, the administration of vaccines, when can we expect them to arrive at vaccination sites where then they can be administered after going through that process, perhaps with SAPRA?
So they obviously come in different batches. So let's start with the 300,000. That 300,000 will likely come in this week, within the next 2 or 3 days. They will then go for testing. I know that the health department has told me that they've already made arrangements ahead of time so that the testing can go quickly. So I would imagine the 300,000 we would start using likely next week, early next week. Then the batch, the 1 million that Aspen will release on Monday, according to Stephen Saad, that batch has already been quality tested. yet. So as soon as it's released, that batch will be flown to OR Tambo in Johannesburg and will then be distributed to provinces immediately. With regards to the additional vaccines that we'll get from J&J, there's not a specific date for that, but we would imagine it's within the next 2 weeks. And once they get here, they will need to get tested. And the testing, how long it takes depends on how large the batch is. So I would imagine that those would be relatively large batches. It takes between 3 days and a week.
All right, good talking to you. Maya Malan, thank you for your time. Bhekisisa Centre for, of course, Health Journalism Director Maya Malan joining us this morning.